Yeah, stomach meridian. We are going to start now the practical orientation for the stomach meridian. So now Chenchi. Chenchi si pai chulio ti kyang te ying chia chi sia kwan to we. So now we try to see the 8 points on the facial region and head region. How many total number of the points on the stomach meridian? On the primary meridian, only the 8 points are existing. If somebody is asking you, so how many total number of the points are the one branch to branch, you can say 8 points in the one branch, the other point is 45 minus 8, you just deduct, and these points are stomach 43 points, 45 points, right? So in that way also you can tell, because the UB meridian also it get terminating, UB10 is terminated, right? UB11 is a separate branch. So in that way you can tell them, there will be more appreciation for you that you have studied elaborately. Now let me see the Chengchi. The Chengchi point is the, do you know there is a socket of the eye, right? Socket means is the closed system. There is a cavity. Inside the cavity what is existing? I is existing. Yes, the ocular is existing. That entire the orbicular orbit inside the eye system is existing. In that eye system, inside the eye, that point is located. Which point is located? Changchi point is located inside the eye. But however, with precaution, and just I apply, please take off immediately these two needles. Once I completed explanation, please take out those needles. So however, it is the supplementary point, and they just apply inside the eye system. So please give me the half tube needle. Now you have to see the upward direction.
Open your eyes.
Manikanda, you can see the upward direction. Vertically below the pupil of the eye. Vertically below the pupil of the eye. I just insert the needle inside the eye. I just applied the needle inside the orbit, right? Now slowly you just close your eyelids. Yeah, now you can bring down. So this is needle is inserted to the eyelid, but we can go further deep. One tune needle we can do the deep, but however I don't recommend you to use this point, but initially it's not advisable to apply. But that's called as a changchi, means is the container of the eye, right? Now you come to the second point to be known as a C pi. The second point to be known as a C pi. So where exactly below that 0.7 tune distal to the stomach 1, there is the foramina. That foramina means is the hollow. Hollow is infraorbital foramen. Infraorbital foramen. Foramen, this is the orbit bone. Inside the orbit, that point is a stomach 1. Outside the orbit, there is the small hollow. In that hollow, that stomach 2 point is located, where the orbicular artery, where the orbicular nerve, where the orbicular vein is passing through that region. That is small hollow. Don't puncture to the deeper level, you just apply the superficial level. I think that's good. So we just use the 0.7 tune distal to this point to be known as a infraorbital foramen region. Rather than stomach 1, better complementary point to be known as a C pi. C means is the 4, pi means is the white. So the patient may not get any kind of the color. There is a vision related problem. Even that condition, if we regularly activate this point, but definitely having the positive impact, the clear vision can be happen once you activate the stomach 2 point. So therefore stomach 2 is always is good, rather than stomach 1 is the complication point. Use the better one is stomach 2 point is good. Yes, any minus plus power is there, then that condition you can use stomach 2 point.
Can you show this from the near way? Thoda pass, yes sir. Sir, it is down from the stomach 1.
Yes, stomach 1 is the, now I just relieved the stomach 1 point. You can have a look of the stomach 2. Yes, if you may not apply the needle, you can give the pressure also. You can activate like this. You can use the stomach 2 point as activation every day for 2 to 3 minutes is good point for the vision related conditions. Now the third point is Now the third point to be known as this is the lower quarter of the nose. So this is the Alanasi. Direct laterally you come Alanasi, then vertically below the stomach 2 point. This point to be known as a stomach 3 point. That's called as a Chulio. Chulio and then the Li20 Yin Xiang very close to each other. Very close to each other point. But however, you can use the stomach 3 point also. Julio is the local point, but however, that can be applicable to treat for the upper jaw related problem or upper tooth related conditions can be treatable by activating this point. Stomach 3 point. Then the stomach 4 point is used to treat for the especially normally we can see the dribbling of the saliva in the night time. The children says that the parents will complain to the us the my child will going to discharge the saliva in the night time, but the whole pillow get wet. In that situation, we can use the we can use the stomach 4 point, point fortune lateral to the corner of the mouth. Point fortune lateral to the corner of the mouth. We can use the stomach 4 point.
The stomach 2 and 3 would be perpendicular.
Yes, perpendicular. Perpendicular would be better. You can use perpendicular. Now the stomach 4 point we just applied. Stomach 4 point outer corner of the mouth. That can be applicable for what condition? Yeah, dribbling. Apart from that, the patient having the problem is the outer corner. They do have some kind of the ulcer formation, stomatitis, something like that. That also applicable to use this point. But generally, it is good for the orbicularis. These muscles called as a orbicularis oculi muscles. These muscles to be known as a orbicularis oculi. This entire muscles to be known as a orbicularis oculi muscles, but this muscles to be known as a orbicularis oris muscles, that also to be known as a kissing muscles. Now the second is this muscles called as a masseter muscle and buccinator muscle. Now let me see where is the buccinator. So masseter. These muscles to be known as a this you can see the lateral oris means is the lip muscles, right? Lateral to the lip muscles, this muscles to be known as a masseter muscles, right? So this cheek muscles to be known as a buccinator muscles. Now on the cheek muscles and buccinator muscles we have the 2 points. Now let me see that what are those points. Now stomach 4 is the Dikyang and then Tiachi. So now Dikyang Deying, where this point is located, we need to palpate where the facial artery is visible or invisible. I think all of you in the Zoom try to find out the proper location. This is the 4. You come down. You come down just below this. You can find the facial artery. You can find the facial. You locate this region, you can find the palpation. So there if the facial artery is good, then the trigeminal nerve also good. When the trigeminal artery also good, when the patient having the problem, when this try to find out when the GB, what we call as a trigeminal nerve related problem, that time the facial artery and the nerve get problem. On that situation, you try to palpate and find out whether the facial artery is there or not there. If it is not there, then you can apply the point over that point itself, that trigger, that regulate the artery as well. So in that way, we just apply. This is the anterior.
Point painful, sir, which you are saying, asking us to stimulate.
No, you feel the. No, you feel the palpation. Once you get the palpation, that means indicating the facial artery is good. But when you apply, you won't get much pain. So that area, if you don't have any problem, you don't get much pain. However, there is a lower tooth related problem having the issue. That time also we can use the painful conditions of the incisors, canine and premolars. Tooth pain is there. Even that condition we can use by using these local points. then this called as a masseter muscles. Then the anterior, and then this is the highest point of the masseter muscles. You just close your mouth and then clench, 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 tooth, you need to clench. And then when he feel mm, mm, where it get hardness, that area to be known as a, which point? Stomach 6. Then the stomach 7. Stomach 7 is the Siak 1. Siak 1 point is located zygomatic bone. Where exactly? So you just touch and then feel this is a zygomatic bone. Just below the zygomatic bone, that to be known as a, please apply somebody. So below the zygomatic bone, stomach 7. So above the zygomatic bone, remember this is the very very important location where the terion or the some kind of the cavity hollow is there. So especially above the zygomatic bone, that area to be known as a trigeminal nerve junction. Do you know trigeminal nerve junction? I'll repeat maybe when I take the gallbladder meridian. Gallbladder 3 point is located just superior to the gallbladder, superior to the zygomatic bone. Below the zygomatic bone, stomach 7 point is located. Above the zygomatic bone, there is the gallbladder 3, that's called as a Shangwan. That point is located. Where is the junction of the trigeminal nerve? From there, it is the maxillary nerve, the mandible nerve, ophthalmic nerve. 3 nerves passes from that region to be known as a gallbladder 3, just superior to the stomach 7. Now, let me see the stomach 8, Toway point. Where this point is located? 3 chun, 4 chun, 4.5, some others write 5 chun. Now from here 3 chun below. So this point to be known as a Tovei. How to locate? I'll show you once again. Please focus and concentrate. This is the glabella. This is the mimetic muscles, right? From here, this is the center midline. From the midline, you just 3 chun, then again 4 chun, then 4.5 chun, right? So now you located. But how to locate? From here 3 chun above. From here, from the eyebrow 3 chun above from the eyebrow, this point to be known as a Towei. To means is the head, Wei means is the stomach. Tungtian means headache. So headache related problem, you can use the local point. Somebody you just apply. Please come forward to all of you and then apply Ubobro on the needle tiring. Just apply superficially. By the way, he is not the patient having the pain of the headache. You just apply superficially.
Sir, one small clarification,
but now here we applied as a 1 chun, but better you can use half chun also advisable. But this region also you can use the half chun is quite enough. But you can use 1 chun also, but precaution, you just take it as a half chun, that's preferable. But when you use the through to through needling, so that time we can use 1 chun, 1.5 chun. But how to use the 3 chun needle, let me see. I will show you 3 chun needle on the abdomen, how need to be activated today. Right. So hopefully we have seen stomach 8, 1 branch got completed. Yes, thank you. They are telling thank you to you.
Thank you very much. Thank you.
Yes, now stomach 8 is over. Now